We're open.
Hello, welcome everybody. We'll get started shortly. So welcome. We'll go over a few housekeeping items to begin with and let some more folks join us. Everyone is on mute for the main portion of the webinar. We will be taking questions at the end of the presentations. If you're connecting via the phone, please press *9 to raise your hand to ask a question, but please ensure you're not on speakerphone when you request to ask a question, as it can cause feedback. We will let you know we'll be unmuting you by saying we have a question from phone number, and we'll use the first 4 digits of your phone number to identify you. We will remute you if you cause feedback when you're unmuted. If you're connecting via the computer, please type your question in the Q&A or chat boxes. We will be gathering these questions throughout the webinar for the Q&A session at the end, so they can be typed in at any time. If you happen to send a question ahead of time to info@ldamerica.org, we will share those questions as well. Lauren Clozier is our technical person behind the scenes. Thank you, Lauren. If you're having any issues at all, please use the chat to send her a direct message. Unfortunately, for those on the phone, we are unable to troubleshoot phone connections at this time. There will be a replay of this webinar sent to all registered attendees within 48 hours of the webinar, barring any unforeseen technical challenges. We will also share the resources and sources cited in this webinar in that email with website links, so you don't have to rush and scramble to get everything down. So we hope you enjoy this webinar, and again, we will send you the replay as well as the resources in the next 48 hours. So Lauren, if you would like to start the slideshow. Thank you, Lauren. So this webinar is by the Learning Disabilities Association and Women's Voices for the Earth. It is on COVID and safe and effective cleaning and disinfecting, and also covers, for the first time, why not to use disinfectant foggers, misters, or electrostatic sprayers. So we're really appreciative that we have Weave on the phone to cover that piece. During this COVID-19 pandemic, there's a big focus on cleaning and disinfecting. It is important to know that proper techniques and how to select safer ingredients. We will discuss the hazards associated with foggers, misters, and electrostatic sprayers, misinformation regarding these techniques, and why they are not recommended by the Center for Disease Control or the World Health Organization. Then we will showcase proper cleaning and disinfecting techniques, as well as safer, non-toxic cleaning products to help protect your family from COVID. This workshop is co-presented by the Learning Disabilities Association and Women's Voices for the Earth. Next slide, please. So I want to share a little bit about our presenters. My name is Tracy Gregoire, and I am the Healthy Children Project Director for the Learning Disabilities Association of America. Today, I am thrilled to have Betty Reagan with me, who also lives in Maine. She teaches sustainable housekeeping and teaches families healthy housekeeping techniques and how to clean at home safely while reducing exposures to harmful chemicals. Alexandra Scranton is a Director of Science and Research at Women's Voices for the Earth. Alex authors Weave's scientific reports and provides scientific review for the organization's programs. Next slide. First, I want to share a little bit about both of our organizations. LDA's mission is to create opportunities for success for all individuals affected by learning disabilities. You may be wondering why LDA is also talking about cleaning and disinfecting. LDA's Healthy Children Project program works to prevent exposures to toxic chemicals linked to neurological harm. So any chemicals that are linked to learning, intellectual or developmental disabilities, or attention challenges. And the Healthy Children Project also works to protect the health of all families from unnecessary toxic chemicals in our products, food, air, and water. Next slide, please. For the past 25 years, Women's Voices for the Earth has worked to amplify women's voices to eliminate toxic chemicals that harm our health and our communities. Women and girls are disproportionately impacted by toxic chemicals, which are playing a significant role in rates of breast cancer, infertility, early puberty, and other health problems. Weave's campaigns focus on the industries that most heavily market and sell to women, including their aim to rid the cleaning products industry of secret ingredients and unsafe chemicals. Next slide, please. So a few disclaimers: we are not healthcare providers and we are not experts on viruses. We will provide our references and supplemental materials with the recording to the webinar. And we are trying to look at the latest science in relation to COVID. The focus of the webinar is several different items: protecting yourself from coronavirus, including safer home cleaning techniques, how to identify and use safer cleaners and disinfectants, and limit exposure to potentially harmful chemicals, as well as sharing proper cleaning techniques. And we will also focus on the hazards related to foggers, misters, and sprayers, and why those are not recommended by the CDC or the World Health Organization. Next slide. So some terminology, just make sure we're all on the same page. Coronavirus is the type of the virus, and COVID-19 is a name given to the disease that is caused by the coronavirus, so the symptoms that you may have. Quarantine is used to refer to people who may have been exposed or a close contact of somebody that has been exposed. And the CDC was recommending quarantine for 14 days after exposure, but now they have changed it to 10 days. Isolation is the term used when somebody is actually sick and needs to isolate or remove themselves from other people in the household and other people from the public so that others do not get sick. We're using the definitions from the CDC for cleaning and disinfecting. Cleaning removes dirt and germs from surfaces, but does not necessarily kill germs. Using soap and water and good technique is often very effective. Cleaning can get up to 99.9% of the virus. Disinfecting uses chemicals to kill germs remaining on clean surfaces. This process does not clean dirty surfaces or remove germs, but kills them. Next slide, please. So just as some reminders, while studies show COVID can live on surfaces, the research so far shows that the dominant source of exposure is from the air. The Center for Disease Control does recommend cleaning and disinfecting, and we all want to protect ourselves as much as possible while also reducing exposures to other viruses like the flu and colds, because this is not the time to be getting sick and then have COVID on top of that. I also know that, for example, at least one person joining this evening has an adult in their household with COVID who is isolating, but obviously wants to do as much as she can to clean and disinfect her household to reduce the risk that other people in the household will get COVID. Some reminders, which we can probably all cite now in our sleep, recommendations from the CDC and the World Health Organizations and others. Obviously, we need to social distance 6 feet or more, wear a mask when we're outside of our house, avoid touching our eyes, nose, and mouth with unwashed hands, We should all be staying home as much as we can, but especially if we are sick or have been exposed to the virus. When you need to go out, we still need to social distance, which is key. Um, and if you have symptoms, call your doctor. Don't just show up at the doctor's office. From what we know about coronavirus, people are most likely to get it from a direct contact with an infected person from the air. But like I said, we all want to do other things like cleaning and disinfecting to add another layer of protection. So now I will hand it over to Betty. Next slide.
Thank you, Tracy. So here we are going into the winter in 2021, and this virus crisis has been with us now for 10 months, and we know a whole lot more about it than we did back at the beginning. There are 3 things we need to keep in mind going into the winter time with this virus. So the virus has spread to all the areas. Now, most new cases are traced to daily activities with local exposure. So that means that it's your neighbors, it's your family, it's your friends that are sharing the virus around. It's not the big super spreader events. It's daily activities and local exposure. Just always, always wear your mask or wash your hands. Number 2, cold, dry air of the wintertime allows the airborne virus to float much longer and over a much greater distance in the air. So the way that works is when the virus leaves the infected person on the droplets and it's floating through the air, as soon as those droplets hit that cold winter air, that moisture evaporates right out, and that leaves all the floaties, all the solids that were in that moisture are now suspended in the air without the weight of the water to pull them out. So 6 feet now is not as safe as it was back in the summertime. Number 3, winter air also dries out our own sinuses, which increases the risk of infection. So now I remember when we did this back in April, we were just beginning to start talking about masks. So now we're talking about mask hygiene. So you want to carry a spare mask because especially in the wintertime, the masks are going to get really moist with all the breathing. And when you take the mask off, handle it by the straps and then put it in a plastic baggie. So when you get home, you can put it right in the laundry, and always be sure to wash your hands. Next slide, please. Keeping it simple. Alrighty. So even though the virus is very contagious, and there's new, even more contagious mutations of this starting to happen, there is one big weakness, and that has not changed. The virus has a protective fat coating around it, but its protective coating can be dissolved with soap and water. So soap and water is the simplest, the easiest, the most practical way to protect yourself against this virus on your hands and on surfaces. So just make sure that you wash your hands with the soap and water for at least 20 seconds. That's not changed, especially after blowing your nose, coughing, sneezing, going to the bathroom, anything around food. Be sure when you wash your hands that you get in between your fingers. Keep your nails short and have a nail brush right ready so that you can get those hands really clean. Fully dry your hands with a towel, as wet hands transmit more germs than dry ones. And the chemistry of soap is extremely effective at destroying the coronavirus as well as all the other viruses. So if you do not have soap and water available, that's when you pull out the hand sanitizer. The Center for Disease Control says that to use alcohol-based sanitizer that is at least 60% alcohol. And the baby wipes, the CDC has suggested that they may make your hands look clean, but they're not designed to remove the germs from your hands. So they're working good for cleaning, but they're not disinfecting. So I'm just going to give you a little crash course in water molecules and cleaning, so you'll really understand this thing about the soap and water. So all cleaning is done by water in motion. Now, water molecules are linked in a long chain, which gives the water its power when it moves. So it'll pick up anything that's in its path as the water whooshes along. Now, oily, fatty, or sticky substances are dense, so these chains of water molecules may slide over the top of them. But any soap or detergent is helpful to water because the soap breaks up these chains of molecules and it makes the water thinner, a little more watery, and then the water molecules can get down amongst the fat molecules, really break that fat protective layer up, lay open that virus and destroy it. So the only way that this soap is really helpful to this water now is if it's thoroughly blended into the water. And in the case of the virus, the water needs to be completely soapy and given enough time and motion to work on that virus's protective bubble. So in the 20 seconds of agitation, meaning the hand washing, the soapy water does the trick. And so back to the slide. There's no good proof that antibacterial soaps clean any better than any other kind of soap. And the FDA has banned some antibacterial ingredients. So when you're looking for soaps and disinfectants to use, avoid phthalates, parabens, and triclosan because they're just super harmful. Chlorine and ammonia-based cleaners are poisons. They're also unnecessary because there are safer disinfectants that are equally effective. Vinegar, soap, or salt-based products for cleaning work very well, and they are non-toxic. Hydrogen peroxide or alcohol and fresh circulating air is the best way to disinfect your home. And we are going to share amongst all the resources at the end of this program, the Vox video on hand washing that's been around since the beginning of the virus crisis. It's still the best way to really show you with your own two eyes how soap and water works on your hands. Next slide. So just like we were saying, many disinfectants and cleaning products can be poisonous. And this is a little chart from 2018 about the main types of poisonings that the poison control gets calls about. And one of the main sources of poisoning each year is household cleaning products, and that is completely preventable. You have to make sure to choose the safest products possible and store them safely. And don't mix ingredients, it could be deadly. I was so sure that everybody knew about not mixing chlorine and ammonia, but just last week on a housekeeping Facebook page I follow, someone suggested that, and there were a dozen of us that came out and said, no, baby, don't do that. But we just need to continue to remind each other about not mixing the ingredients. Next slide. I'll turn this over to Alex.
Terrific. Thanks so much, Betty. And yeah, just to follow on what you were saying, Women's Voices for the Earth, or WEAVE, we've been really concerned about the harms of disinfectants for a number of years. We've been trying to educate folks on the harms of disinfectants. And we've been particularly concerned in the last year because of the massive increase in use of disinfectants, particularly around the home and in businesses and in schools. So I'm going to talk a little bit about some of the disinfectants that are being used against COVID, and then I'll get sort of into the foggers and misters and sprayers. So EPA, the Environmental Protection Agency, they keep this list called List N. You can find that website right there. And these are all the list of products that are effective against the coronavirus. So when I checked it in December, there are 516 products on List N. What we've noticed is that the vast majority of the products on that list, so there's 241 products, 47% of the list, where the active ingredient causing the disinfection effect are called quaternary ammonium compounds, or quats. The second highest category are sodium hypochlorite, or better known as chlorine bleach. Another 72 products, or 13%. So 60% of the list is either quaternary ammonium compounds, quats, or bleach. And this is what you'll also commonly find in the store, these two active ingredients being the most dominant ones there. And we're really concerned about some of the side effects that either of these chemicals have on our health. But what's good to know and important to remember is that they're safer and equally effective alternative products on list N too. So they're products made with alcohol or ethanol, hydrogen peroxide, lactic acid, citric acid. These are all active ingredients. There's no hierarchy on list N. It's not like, well, I'm really, really concerned, so I'm going to use the quats because that's stronger stuff. The alcohol, the hydrogen peroxide, they're all equally effective and equally strong. In the resources, we'll list a database from the city of San Francisco called SF Approved. They actually have taken the list N and pulled out all the safer alternative products. So that's a really good resource if you're looking for safer products to use. So let's go to the next slide. So what are some of the chemicals we're concerned about? I talked about quats, quaternary ammonium compounds. They're very commonly found in disinfectants, and they're certainly quite potent chemicals. They're really potent skin irritants. They will rough up your skin, causing rashes and dermatitis if you get it on your hands. It's particularly problematic because they're in a lot of wipes, like disinfectant wipes, where you're getting a lot of hand exposure. They're terrible for your lungs. They lead to breathing problems when they irritate your lungs. We know this because cleaning workers that are exposed regularly to quats from use in their job, they have a much higher risk of developing occupational asthma as a result of that exposure. We're also concerned about reproductive harm from quats. We know this from animal research. We don't have the research on humans, but in mice, for example, mice that are raised in cages that have been cleaned with quats have a terrible time getting pregnant. I mean, terrible fertility problems. The ones that do have much higher risks of birth defects like neural tube defects. Now, we don't know if these effects are also happening in humans because no one's ever researched it. But from a precautionary standpoint, we're very concerned about how many women of reproductive age are exposed to these chemicals regularly, especially in the last year when they're being used more commonly. And then lastly, quats are contributing to this problem of antimicrobial resistance. And this is the creation of superbugs. So you'll get E. coli or staph infections. And these bacteria are sort of, they're exposed to quats and then they become resistant to quats. When they're resistant to quats, they're also resistant. They become cross-resistant to common antibiotics that we need for public health. So we have a real problem of creating these superbugs that we can't control with the antibiotics that are available to us. Okay, let's go to the next slide. Chlorine bleach is the other one that we're really concerned about. As you know, if you've ever opened a bottle of bleach and held it anywhere near your face, it's a significant lung irritant and eye irritant. You'll sort of cough immediately, your eyes might start to water. It can cause significant chemical skin burns if it gets spilled on your skin. The data we've seen is that it's the leading cause of chemical eye injuries in kids in the US. This is most commonly happening with spray cleaners and disinfectants that contain bleach. The kids get a hold of them, they accidentally spray them in their eyes and can experience near blindness. So there's some very serious injuries that are happening very commonly with bleach bleach products that you can just buy in a grocery store. They are also the leading cause of calls to poison control for the category of cleaning products. And Betty mentioned that cleaning products are a major category of calls to poison control. Well, for those cleaning products, bleach is definitely number one. It is the product that is most often causing people to call. It also, when they follow those calls and find out what happens to the folks who have called, it results in the greatest number of kind of moderate to severe health outcomes. Sometimes people call poison control because they're just concerned, but they're not actually experiencing any impacts. With bleach, you're more likely to see those severe health outcomes, people going to the hospital, going to the emergency room, the eye injuries to kids and that kind of thing. So we're very concerned about these impacts. Okay, next slide. So I want to get into the disinfectant misters and foggers. These products, they're, sort of these spraying products, they generally have a tank. They can use lots of different chemicals, but we've certainly seen ones that use quats. We've seen ones that use chlorine bleach. We've seen ones that use hydrogen peroxide. There's usually kind of a recommended disinfectant or cleaning solution to use with any one product, but often you can put anything you want in the tank. So we're very concerned, particularly about quats and bleach being used in these products. Now these disinfectants, they make a lot of misleading promises, these manufacturers of these products. So these are kind of the myths that they are telling you, which make them very saleable and attractive to people who are responsible for cleaning public spaces particularly. For one, they'll tell you they're time saving. You can disinfect a whole room in a matter of minutes. You can disinfect a school bus in 60 seconds, right? They say they're labor saving. You can just spray. You don't have to do all that manual wiping of surfaces. They'll tell you that it's quick drying. Just minutes after you spray, you can enter a room safely. It'll all be dry. They'll tell you that it's effective. I mean, usually they're implying that it's effective, that you want to use this because you don't want people coming into the space you're responsible for getting COVID, right? So you're going to use this to reduce or eliminate that risk of transmission and make it a COVID safe room, right? And then some products, not all products do this, but there are some products on the market that claim that the disinfection effect will actually last for days to weeks. You can spray it once and you're good for a week, right? These are all, as my slide says, too good to be true. You cannot believe these claims, and they're very misleading and can lead to dangerous situations. Let's go to the next slide. So here's some of the reality of misters and foggers. They're not actually time-saving or labor-saving in the end. The reality is, in order for disinfection to work, and this is something the CDC says over and over again, all surfaces that are going to be touched, they need to be pre-cleaned manually for disinfection to be effective. The reality is surfaces get dirty, they're covered with goo or soil or dirt, and those viruses and bacteria, they can hang out in that goo on the surface. And they're just fine. You can spray it all you want. If they're sort of buried in that goo, they're gonna still be effective. They're still gonna be contagious, right? So surfaces have to be manually wiped down before you spray them. So it's not saving any time. You're just doing an extra step by doing the spraying, and it's not saving any time. If you're going to be effective, you still have to do all the manual wiping. As far as quick drying, this is a really also misleading and kind of red flag kind of claim. First of all, there's no science available, and believe me, I've looked, nobody has ever published this, that measures how long these disinfectant particles stay in the air after spraying with one of these sprayers. We simply don't know how long they continue to circulate before they settle down, or whether they even recirculate after someone comes into a room. You don't want these disinfectant chemicals to be breathed into your lungs. It's putting them through a sprayer puts them in very small particles. It puts them into the air where you can breathe them. We don't know when it's safe to enter a room again after things have been sprayed. No matter what they'll tell you, they'll guess sort of 10 minutes. We really don't know how long it should be before it'd be safe. Secondly, if they do in fact dry so quickly, they might not have the effective dwell time that the disinfectant needs. These things have to be wet on a surface for a certain amount of time for the disinfection to actually work. If they're drying too quickly because the particles are too small, it might not actually be doing anything as far as disinfection at all. All right, let's go to the next slide. Okay, so here's about, are they effective? And this is really the meat of what the companies selling these products are telling you. There really is no science available to show that when you've disinfected a room in this way, that anyone's getting less sick as a result, right? No one's been able to prove that when you're doing this kind of disinfecting, that transmission of a virus is reduced or even eliminated in these rooms. And there's really, since the pandemic has started, no good convincing evidence of people getting COVID transmitted through contaminated surfaces. Cleaning is a great idea, and doing some targeted disinfection can be a good idea too, especially when there's been particular, a person with COVID sort of in a room, but it's a precautionary kind of additional step. It's not the primary way that people are getting this. It's much more likely to be transmitted through the air, person to person. So, we're all for cleaning, and cleaning can be a great thing. But we also have to be aware we don't want to be cleaning and disinfecting and causing these other health effects in the process. When it might not, in fact, be doing any benefits for our health. And as a result, we've got these two sources here. Neither the Centers for Disease Control nor the World Health Organization support the use of these products, foggers or misters, for disinfection. They just haven't found the evidence to show that this is an effective way of disinfecting and protecting health. All right, let's go to the next slide. And this is an interesting one. Are they long lasting? They're very deceptive claims on this for the products that do claim this long lasting effect. The EPA is very clear on their website. They've never approved a product claiming to be effective against COVID or any other virus for that matter for days or months. Like, it works immediately when you use it, but it does not last and provide any kind of disinfection process. There are a handful of products where for bacteria, it can give you, 24, maybe 48 hours of disinfection, continuance on a surface, but not for viruses. So often these products will have one of those chemicals in there. They'll be good for bacteria for 24 hours, but not for COVID, but then they're advertised as a COVID safe product. So very, very deceiving. But the other thing you'll often find in the fine print is that the disinfection claim, it will continue as long as nobody touches the surface after you spray it. So it's kind of pointless. If no one's going to touch the surface, no one's going to get anything from that surface. It doesn't matter whether it's disinfected or completely covered in COVID if nobody touches it, right? So very, very deceiving, not something to be believed. So our conclusions, really, like the CDC and the WHO, we don't recommend these products. They certainly can be very expensive, and misting and fogging, they can actually just increase your cleaning costs if you're doing it appropriately, because you've got to spend the time to wipe down surfaces anyway. You're just adding that additional step with an expensive machine. You're also really increasing your chemical exposure. You're putting it into the air where it can be breathed in, either by the person applying it or people who come into the room later. So it's really adding that additional exposure. And there are very, basically no proven health benefits from doing this. And there's a concern that misting and fogging could create this false sense of security. I mean, one of the websites I was looking at says, you can disinfect a school bus in 60 seconds. Well, that sounds great when you're worried about disinfecting a school bus. But if you're not wiping it down, those things are covered in goo. I mean, there's all kinds of places that bacteria and viruses can hang out, no matter if you're spraying it for 60 seconds or not. It could lead to people being, lax adherence to other preventive measures by, not doing the pre-cleaning, maybe not wearing a mask, because I think the room is now COVID safe because it's been, nuked with whatever is in the sprayer. So these are some of the concerns we have, and some of the, the real reasons why these machines, although they're very popular and they're being sold like mad, are really not doing the job that they're being promised to do. So I will turn it back to Betty to talk about effective cleaning and disinfecting that we can do.
Thank you, Alex. So what are we going to do? We are going to safely and effectively clean and disinfect. And the way we're going to do that is we're going to read the labels. We're going to choose the safest and most effective cleaners and disinfectants available. Like I talked about the soaps earlier, all disinfectants are not created equal, and we know some are more harmful than others. So we've done the research, and we've cross-checked the EPA list of approved disinfectants against the coronavirus, and cross-checked it with the Environmental Working Group's list of safer products. And we keep coming up with the isopropyl alcohol and the hydrogen peroxide. Also, there are other cleaners that, and even hand sanitizers that have thymol, which is safe. It's the active ingredient in thyme, the herb thyme, and lactic acid and citric acid are also much safer than other alternatives for cleaning and disinfecting. So when I'm about to clean, the next thing I consider after what cleaner am I going to use is you have to take into consideration the surface itself. Now, some surfaces can't take a lot of water and soap, like for instance, doorknobs, light switches, electronics. You just can't do the 20 seconds of soap and water on them. That's where the disinfectants come in. They don't need as much water and as much agitation. They need more time. So you just have to make sure to give them adequate time to do their job. And what they're doing is they're getting through that fatty layer on the virus. Let me see. So what else did I need to say about that? Excuse me just a second. Okay, so for the coronavirus, it's been suggested that hydrogen peroxide adequately saturating the surface can kill the coronavirus in about a minute. For rhinovirus, which is the common cold, it takes longer than that. So when I clean my public restroom that I'm responsible for, I spray everything down with the hydrogen peroxide and I let it set for 10 minutes. But that's just me. 1 minute has, the CDC has said that 1 minute is adequate, but you just have to make sure that all the other criteria is met. It's completely coating the surface that you need to disinfect, and you're going to give it enough time. Okay, so it is always a good practice to wear a mask and gloves and open a window or increase the ventilation the best you can, especially in small areas when you're using any of these cleaning products. And this PPE, a word that we didn't know a year ago, the masks and the gloves also is going to protect you from the virus. Okay, so when we use the alcohol, it breaks up the fats quickly, and it also cleans the oils from your fingers. And so sometimes when I'll do doorknobs and switch plates around this building that I have to keep clean, I'll take the hand sanitizer and I'll squirt it right on a cloth and use that to clean. But anyway. Okay, so a word about those disinfecting wipes. Now, disinfecting wipes, they only contain about enough moisture to coat a really small area. And the parameter that you have to meet is that this disinfectant has to completely coat the surface and make sure that it stays wet long enough for that minute minimum to kill all the virus. So those little disinfectant wipes, you're not going to get much distance out of those. They're good for just like this immediate hands or maybe to get that doorknob. So just keep that in mind. Okay, next slide, please. Tools and techniques. So to save money and the environment, I like to use a washcloth instead of a paper towel. And I'll give you a little demonstration here. So if you take a washcloth and you fold it into quarters, it's about the size of your hand. So when you're washing something, anything that's bigger than the size of your hand is a waste because you can't control it. And if you take this washcloth and fold it into quarters and you're cleaning along, it doesn't take much before this surface is now too dirty to pick up any more of the germs and the grime, because after a while you're just smearing it around. But with this folded washcloth, you can take this corner and you can fold that up like that, and you have another clean side and you can keep going. So you wipe, wipe, wipe some more. Whoops, all dirty. I'm just smearing it around. I'm going to fold that dirty corner out of the way. I have a whole new clean corner and I'm cleaning. So with one washcloth, if you're just dusting, you can get 8 clean sides. And if it's something that's really mucky or it's really soaking the cloth, then you'll get 4 clean sides. But even if you go through a dozen of these in a week, that's not adding much to your laundry, and it's saving you a lot of paper towels. Also too, about techniques that I've learned over the course of my many years as a housekeeper is the squirt bottle, spray bottle question. So when you use a spray bottle and you're spraying these cleaners through the air, many of these household chemicals are volatile, meaning that they evaporate quickly. Chlorine and ammonia are the two most volatile of all, and they sell those to us in squirt bottles. That means that you're spray bottles. So you're spraying it like this, and then you lean in to clean that window, and you can feel that mist right on your face, and you're absolutely guaranteed to be breathing this stuff in. So for any typical household cleaners, I use a squirt bottle and I squirt it onto my cloth. That way it's not spending any time in the air. I'm controlling the whole situation. The only time that that spray bottle is what you really need is when you're using hydrogen peroxide as a disinfectant, because you need to coat that surface completely with the hydrogen peroxide, and the spray bottle is the best way to spread that around. The very best thing about that situation is that hydrogen peroxide is not particularly volatile. It doesn't evaporate easily. So I'm a big fan of spray bottles for that, and a big fan of squirt bottles for all the rest of the cleaning chemistry that I use. So let's see if there's anything else I needed to discuss on that. I think that's what I have. So I'll send this on to the next slide, and back to Tracy.
Thank you, Betty. So just to do a quick summary, right? CDC guidelines are basically unchanged, right? We need to social distance, wash our hands, wear masks. As Betty explained, winter air is a little bit different. Having more space between you and other people, whether inside or outside with winter air, is important, and we'll share some resources around that. We know that the dominant way that coronavirus is spread is through the air and through those particles that are held in the air from the virus. For cleaning and disinfecting, of course, we want to do everything we can to limit any possibility from surfaces as well, and also protect ourselves from cold and flu and other viruses and bacterial infections, right, during this time. It's really important to first clean, then disinfect. A surface needs to be cleaned in order to use that disinfectant, whatever you're using, to actually kill what's on the surface. If you have grime and dirt or on the surface, that disinfectant is not going to work nearly as well. The good news is that there's a lot of safer options and safer ingredients for disinfectants, as we went over, and we'll share that by email as well as a list to that the EPA's list of approved products that are effective against the coronavirus. And there's also some cool things you can do with that list that we'll share in the notes as well, like sorting that list by the active ingredients so you can find products, safer products. But even with, safer products, be mindful of ventilation, using gloves when you're using products to protect yourself. Know the facts about foggers, misters, and sprayers. If it sounds too good to be true, it probably is. And unfortunately, the way things work with, viruses that are on surfaces, right, as soon as that virus is touched, right, it can be recontaminated. Neither the CDC or the World Health Organization support the use of foggers or misters for disinfection. We will get through this together. Please let Learning Disabilities Association and Women's Voices for the Earth know how we can help you. And we have a little image that Betty found, spread the kindness, not the virus. I do want to go over some quick resources. And again, all of these will be emailed to you with the recording. And then we'll go to some Q&A. Next slide, please. So some of the resources we'll share with you with the links. LDA has two websites. We have our healthychildrenproject.org website, which has all of the information on chemicals linked to that can harm children's and people's brain health. And we have the Learning Disabilities Association of America's website as well. Environmental Working Group has a guide on cleaners. Healthy Schools Network has a lot of great resources when it comes to cleaners, disinfectants, as well as other resources on how to help your schools be healthier for everybody. We'll share some CDC resources, a link to the poison control and data, the article on winter air and how it's different and how it unfortunately helps spread COVID easier, the Vox hand winding video, the EPA's list of approved disinfectants. Weave has a number of wonderful resources that are really accessible and I find extremely helpful. Even though I've done this work for a long time, they have a great toolkit on how to talk to your child's school about safer disinfectants, which is great. They also have a one-pager on foggers, misters, and sprayers that is also really helpful and kind of says it in common everyday language. And some of their stuff is also translated into Spanish, which is fabulous. We'll share some of these other fact sheets, like the Pediatric Environmental Health Specialty Unit has a great safer disinfectants fact sheet, the CDC guidelines on environmental fogging, and some WHO guidelines, the World Health Organization on cleaning and disinfecting during COVID. So we'll share all of those with you. So now I think we have about 15 minutes for questions and answers. And I will start with one that was emailed in to us, asking to kind of rank some of the different options for safer disinfectants and which ones are most concerned. And Alex and Betty, you should feel free to chime in. I think that, you know, the bleach and the quats are kind of at the high, like don't use, try to avoid, should be in the hands of professionals and only used when really needed because, you know, we don't want super bugs, right? And those really should be used. And unfortunately, they are sold to everybody on the shelves, but those would be the ones I think we'd recommend avoiding if at all possible. And if you use, you know, something like bleach, please, 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 you know, ventilation is really important. Gloves, a mask, you know, would be appropriate in that situation. And really any of the safer alternatives that we give, some of them might have a little bit varying time on how long, you know, for hydrogen peroxide, and I think for ethanol, it's about a minute and it kills COVID, but it takes more like 6 to 8 minutes to kill the common cold. So you might want to keep it on for 6 to 10 minutes, coat the surface, leave it and come back if you want to kill everything, right? Because we don't want to be getting sick with other things right now. So hopefully that's helpful, and we can certainly, you know, try to delve into that a little bit more if helpful.
And some of it is also kind of personal preference. I mean, you know, there are different products that have different ingredients that people like, you know, for different applications. So I think from a safety standpoint, I'm pretty good with all of them kind of equally, of the safer alternatives. And certainly they're all equally effective against COVID, but sometimes it's personal preference.
Yeah, thanks for adding that.
I just haven't been a housekeeper for a long time. And now that I teach housekeeping, I still want to make sure that everyone's clear that I'm not going to tell anybody what to do in their own home. What we're trying to do is just educate you so that you can make the best decisions for your own home. And that's kind of the way I roll. So it sounds like we're all kind of the same.
Great. And I see somebody put in the chat about using the microfibers, and my understanding with that is you don't want to wash them. You want to hand dry them. Is that right, Betty? Because they're more effective if you don't wash them.
Right. The way those microfibers work is they're very small little plastic hooks is what they're made of. And so once those hooks get full of whatever they're hooking up, then you know, they're not as easy to wash out. So you do wash them in the washing machine, but you do not dry them. You have to air dry them because the heat from a dryer would just shrivel that little curly hook.
Right. So Judy asked about, what can you tell us about the health concerns related to disinfectants that promise extended periods of time, like staying on the surfaces for up to 24 hours?
Yeah, and I think I sort of mentioned that if you look at them very closely, they are only referring, and if they're even really doing that, they're only referring to bacteria on a surface, not to viruses. There's nothing out there that we know of that the EPA has certified to be effective for 24 hours against a virus. And a lot of them, even if they're saying they're good for 24 hours, if you're affecting the surface, if you're touching it, if you're rubbing it off, you can reduce that pretty easily. So not something to be particularly comforted by. I mean, you have to be realistic that when a surface, you can clean a surface and you can disinfect it. When it gets touched again, it can get repopulated with germs very, very quickly. So.
Right, and I think Betty covered this, but those commonly touched items like the light switches, right, counters, things that people, doorknobs, like spraying those, right, doing, cleaning those well and cleaning them often, especially if you have somebody that has COVID or just is really high risk, right? Isolate the person if you can. That's not always possible given, some people's houses and, having one bathroom or whatever, but you do the best you can, right? And clean those surfaces often, which is probably more important than what you're using, is that you're cleaning them often.
Absolutely.
Right. Great point.
Therese says, my concern is with the toxic properties of fragrance, hand sanitizer. Fragrances are harmful, and this includes essential oils. Can this be changed so products are safe? Yeah, fragrance is a big issue, and it's, they don't often, you can just hide chemicals under fragrance. Although my understanding is if you're using essential oils, you have to list them, but synthetic chemicals, you don't. There are some states, I think California recently passed something that fragrances have to be shared, like what that fragrance is. And phthalates are commonly used as fragrances. Some of the phthalates do have strong links to neurological harm, like harming children's brain health, and LD is really concerned about that, right? So, things that are not fragranced is better. The funny thing is, like, people think, oh, I cleaned something and it has this lemon scent, like it's a signal that it's clean. It's not. Like, scent doesn't do anything to clean. Clean has no smell, right? So yeah, and essential oils, like, I'm really sensitive and I break out very easily and have skin issues. I can do some essential oils, but essential oils people can also react to them. So that's something to be careful about. But there are fragrance-free, totally unscented products that are out there. It's just finding those products. And we use, an unscented hand soap at home, so that, and I'm very careful. Like I said, sometimes I can do some essential oils, but sometimes I can't.
The
Lorena?
fragrance has nothing to do with what's making it clean or,
right.
or disinfected. It's, it's purely marketing. People like it. People have associations with it, and the marketers know this. And so many cleaning products are heavily scented, but it's just adding more chemical exposure.
Right.
And usually unknown chemical exposure. You just often don't know what's in there, and there's some really dangerous chemicals that can be found in some fragrances. With the law that passed in California, we're sort of starting to look at that and seeing what's being disclosed. And there's just some scary stuff that's being used that you wouldn't know was in there. You think, well, it just smells like lemon. Well, sometimes there's no lemon in there. I mean, it's all synthetic chemicals that are just adding to your body burden of chemical exposure. So unscented is by far the way to go.
Right. Advertisers also are very well aware that women in particular are very connected to scent. It triggers us, we love the scent of this and that, and women are just really sensitive to scents, and so they use that against us to sell this stuff. And back in the day, there was pine in Pine Sol. I make my own pine sol. I make tea out of pine boughs. When I believe it was Procter & Gamble bought the rights to pine sol, they immediately dropped pine because they have a chemical that smells like pine that was going to satisfy all these ladies out there. And they're going to tell them that you don't have to boil the water and make the tea anymore. We're going to do it for you, and we're going to sell it to you. And there's no pine in there.
Right.
There hasn't been for generations. That so upsets me.
Right. So I'm going to try to go through because we have a number more questions,
Right.
which is great. Lorena said, where can I find lactic acid-based cleaners? I'm not sure. We could try to find that out. I don't know, Alex, if you know, or Betty.
Yeah, I mean, there are some that are made by kind of Lysol, Clorox, you know, they are harder to find. I mean, the companies have been, you know, really upping the manufacturing of products. It's unclear whether they're upping, you know, the safer alternatives or they're just making more quats and chlorine bleach. So they can be hard to find. You got, you know, you can scour the internet for sure. I know that San Francisco approved list, it has, unlike List N lists everything by their EPA registration number and the product name that EPA registration number was originally given to. So sometimes there'll be, you know, 15 different products using the same number, but they only have one name on list N, which may not be a brand you recognize. But the San Francisco list has gone through and found the more familiar brands and names. So I'd look there. And certainly, you know, your voice is important. Ask your grocery store, you know, like comment on Amazon, like, where can I find these? This is what I want. I mean, that's what manufacturers need to hear, that you're looking for these alternatives, that you don't want clots, you don't want bleach. What's the safe thing you can give me? Because they're going to provide it if they know you want it. So.
Right, and we'll provide those two lists so you can kind of look up product names. Let's see. I apologize if I missed this, but if soap and water destroys coronavirus and other viruses and bacteria, why is it important to both clean with soap and water and then disinfect?
This is a really good question, and it's a question that I have as well. The CDC says to clean and then disinfect. There's very little data that extra disinfecting step makes any difference to our health. I mean, you can get rid of, you know, 99.9% of what's on the surface with cleaning. Disinfecting gets you to 99.999%. Whether or not that makes a difference to your health, it's absolutely an open question. There just aren't the studies showing people are getting less sick from doing the disinfecting as well. But that's the recommendation they're going with. We don't want to say that that's not a good idea, but there's very little science to back it up that cleaning is not actually doing the job.
Yeah, when I was looking with Betty, you know, like updating some of our resources and looking back, I was like, should we say soap and water? And CDC says to clean, you can use soap and water, right? It's totally appropriate. Right? And it just goes to show that you don't always need the more expensive stuff. You know, soap and water will do the job, especially the technique, right? Do the technique. So Jared asked about opinions on hypochlorous solutions. I'm not sure what that is. Do you know, Alex?
Sure. Hypochlorous acid and hypochlorous solutions, that they're becoming, again, sort of a more popular thing in the time of COVID. And so I've heard a lot more about them. And we basically need more research on them. A lot of what they are, you kind of take water and salt water and you run electricity through it, and it basically creates, it sort of pulls the chlorine out of the salt and creates basically a very, very weak bleach solution. So the advantage is you're not dealing with chlorine bleach that is highly concentrated, and the risks, you know, associated there. Like it starts out water, you get, you know, it disinfects quite well, and then it kind of dissolves back mostly into salt and water. And there usually it requires sort of a machine that sort of creates it. It's not very stable, so it won't last very long. So it's hard to bottle and use later. One of the issues with chlorine bleach and chlorine technology from an environmental perspective is that it creates these chlorine disinfection products. That is where the chlorine that's from the chlorine bleach kind of connects up with organic matter and creates these things that contaminate water, and, you know, goes downstream, eventually contaminating drinking water. So there's a question of whether or not hypochlorous acid can also do that, certainly to a lesser effect than chlorine bleach. But whether or not it's just like a lesser bleach, so it's a little bit better, or whether we really should just be using, you know, non-chlorine technology. So there's a lot of questions that need to be answered, but that's what I know about hypochlorous. Yeah.
Okay, thanks. Phyllis asked if you dilute bleach, is it still unsafe? Does it make it better?
It certainly makes it better, but the process of diluting it can be very dangerous, right? Because you're taking the really concentrated stuff and it can splash when you're diluting it. So there's a lot of, that's where a lot of accidents happen. So that is certainly a concern. And then for that environmental impact, I mean, it can be quite dangerous when they're making it on the, you know, on the front end. It's dangerous to workers in communities where the chlorine bleach is made. And then it can create these disinfection byproducts down the line, sort of after you use it. So dilute bleach is certainly better for your personal health, unless you're doing the diluting yourself and there's, you know, an accident can happen or spills. Yeah.
And Bonnie asks, are quats in particular more likely than other disinfectants to cause superbugs, or is it just disinfecting in general causing resistance?
Quats are more likely. I mean, it's one of the ones where, you know, they've really done a lot of testing and are finding these quat resistant bugs. You know, you're just not finding kind of these alcohol resistant bugs. You're not finding hydrogen peroxide resistant bugs. Quats seem to do something that creates this resistance. So yeah, specifically they are much more of a problem contributing to superbugs.
Right, and Laura just notes, or Lori notes, that it's hard to find unscented products. It is, even in schools, it's definitely true.
Yep.
Unfortunately, but again, asking,
we need to create this demand.
Right,
you know,
right.
We need to be asking for it. Yeah.
And she also says, you know, we can be careful in our own environments, but also toxic overload in schools, work, businesses, especially where air fresheners are used. And yeah, I know teachers who have retired early because of chemicals in the classroom and mold or other things. And just, you know, and it with schools with, you know, older schools, ventilation issues, it's a really big issue. And it's a big issue for COVID. It's an equity issue and a social justice issue as well.
And if there are folks, you know, listening to this who are interested in kind of doing something about it, we do, Women's Voices for the Earth has a People Against Quats group, and I know there are a couple people on the line who are part of that, and thank you for being part of our action group. So we're gathering people kind of once every other month on the phone to talk about what we're doing in our communities and how we're convincing schools to use safer products and where you can find them. And so if you're interested in that, the link will be in the resources, and you can join at any time. We'd be happy to have you if you're interested in working on creating that demand and creating change in your community.
Yeah, and I'm going to try to like zip through a couple more. I know we're a little over time, but there's a couple more questions. Meredith says, I have a product called Rejuvenate, which is an accelerated hydrogen peroxide. Is accelerated hydrogen peroxide a real thing, or is it a marketing? If it's a real thing, is it stronger solution? Is it still safe?
It's a question I have too. I have seen these products, these accelerated hydrogen peroxide products, and often they're not disclosing their full ingredients. So I don't really know what's in there. So some of it is probably just hydrogen peroxide, which, you know, may be better than other alternatives, but there's not a full disclosure on a lot of those products. They seem to be keeping this proprietary technology, which is always kind of a red flag for me.
Right.
You know, when companies don't want to tell you what's in there, then you worry about what's in there.
Right.
Yeah.
In Washington, let's see, sorry, keep scrolling on me. In Washington, there is a state purchasing contract for nonprofits and governors who can get producers all approved by Green Seal at the discounted price, right? So there's, you know, purchasing, like, right, collective purchasing definitely does make a difference and creates a demand and a supply for some of these safer products, absolutely. Let's see, do HEPA filters eliminate COVID germs?
Do HEPA filters? I think the science is not totally clear on that. I mean, they haven't. The CDC has not come out with kind of recommendations on what air purifiers are doing. You know, how well you can filter these things out of the air, especially when you're concerned about air transmission of COVID. I think there's probably a lot of research going on, but I don't think we fully know how well those are working versus kind of recirculating air in a potentially dangerous way. There's a lot of differences in how these systems work. So I don't think there's a good answer for it.
Right. There's another question: do ultraviolet lights attachments to filters help? I think that the jury is still out on that, right? Too, the ultraviolet
can kill viruses and bacteria quite well. Again, I think it depends on the system and how long they're exposed to light and how well it works. I think there's, again, a lot more research that needs to be done, but UV light is certainly a good alternative.
The variables are so great that they can't make a blanket statement.
Right. Mm-hmm.
Right. So another question from Lisa, would you say green cleaning products save money since the products serve multiple purposes, so less products are needed? If so, do you have resources on this? I mean, certainly you can get hydrogen peroxide, right? That's the active ingredient. You can get hydrogen peroxide, right, and use that, right, which is definitely cheaper. Sometimes the safer products, like if you're buying 7th generation or things, and which I do use, like you can be paying more. So I think it depends on which products and whether you're, just using a one ingredient like hydrogen peroxide, or if you're right.
Yeah.
Well, I'm not a big Walmart fan in general, but there are certain things that I buy from them specifically because I want to send them the message that we want more of this. So I buy 7th generation products from them, because that's with my dollar vote. I'm suggesting that they carry more of this, and I'm not going to buy that. I'm going to come back and buy this, but that's all my dollars you're going to get from me till you get something else that I want to buy. And it really works.
Anything to add on that, Alex?
No, I don't think so. I think we covered it nicely.
Yeah, we have comments on UV, like not recommending it, recommending air filters. Certainly like some of these things, right? Like I have an air filter in my home, but they're not all created equal, right? So knowing what you buy, trying to do that research, look for those studies that say that this one has been independently, right, studied and shows things, right? You have to kind of be an informed shopper, right? And not just allow yourself to be greenwashed or, right, advertised to. So, certainly during your homework helps. I think we answered most of the questions. Certainly if we didn't reach out to us, we will send that email. We are sharing, names and emails with Alex so she can share information. You can opt out of any of our lists at any time, but I think Weave is a great source of information and has some wonderful sources. So I think it is helpful to at least, get some emails, but I really appreciate, like we had over 70 people live, and I think 200 people or so register. So I'm really excited. Please share this information. Let us know how we can be helpful, and I hope you all stay safe and healthy. So thank you, Alex. Thank you, Betty. And thank you everyone who joined today, and for Lauren for doing tech for us.
Thank you.
Thank you. Thank you very much.
Yeah.
Thank you.
Thanks, everyone.
Bye. Be well.